You know the drill, right? You're at the doctor's office, sitting on that crinkly paper, and then you feel it. That surprisingly cold metal disc of the stethoscope on your chest or back. The doctor leans in and says, "Okay, take a nice deep breath for me." But what are they actually listening for in there? Seriously, have you ever wondered? It kind of feels like they're listening for some secret code, a password that unlocks what's going on with your health. And you know what? In a way, they are. They're tuning into the incredible symphony of sounds your lungs make with every single breath. So today, we're going to decode that symphony together. Now, this whole process of listening in has a fancy medical name. It's called auscultation. It's one of the most fundamental tools a doctor has, allowing them to hear the otherwise silent internal workings of your body. It's pretty amazing when you think about it. So, what's the very first thing a doctor is trying to figure out? Well, it's actually pretty simple. They're asking one basic question. Are the sounds I'm hearing normal? Or is there something extra in there? An unexpected noise that just shouldn't be part of the show? See, healthy, clear lungs have a signature sound. It's called a vesicular sound, which is basically just the soft, gentle whoosh of air moving through open pipes. But when those pipes, the airways, are blocked or narrowed or filled with fluid, you get these extra adventitious sounds. And spotting those extra sounds, that's the very first clue. All right, let's build our own little sound library. We're going to break down the four most common abnormal sounds a doctor might hear. We'll talk about what they sound like, and more importantly, what they might mean. First up, we have crackles. You might also hear them called rails. These are these short little popping noises, almost like clicks or bubbles, and they're usually heard when a person breathes in. The thinking is that this is the sound of tiny little air spaces that were closed suddenly snapping open. Pop, pop, pop. Okay, here is the absolute best way to imagine what fine crackles sound like. Picture pulling apart a piece of Velcro right next to your ear. That sort of short, sharp, popping sound, that's an amazing comparison for what a doctor is hearing. Next up is a sound a lot of us might already recognize: wheezing. This is that continuous, high-pitched, almost musical sound, kind of like a whistle. It happens when air is being forced through narrowed little airways, which is exactly why it's such a classic sign of things like asthma. Then there's raunchy. You can almost think of raunchy as the low-pitched cousin to wheezes. It's still a continuous sound, but it's much deeper, coarser, often described as a gurgle or even a snore. This sound tells us that air is flowing through the larger airways, which are probably blocked up with something like mucus. And finally, we have stridor. Now, this one is very distinct. It's a loud, harsh, high-pitched squeak or whistle that's heard when you breathe in. Stridor is a really big deal because it points to a major blockage in the upper airway. We're talking the windpipe or the back of the throat. It's a sound that gets a doctor's attention immediately. Okay, so we've got our four main sounds down. Now for the fun part. Let's decode them. What do these clues actually tell us? What's physically happening inside the chest to make these different noises? A lot of the time, the difference comes down to pitch and location. Let's take wheezes and rhonchi again. They're both caused by restricted airflow, right? But the high pitch of a wheeze points to the tiny, small airways being narrowed. Meanwhile, the low pitch of rhonchi suggests a blockage in the big, large airways. That one little difference in sound is a huge clue for a doctor. And this is why these sounds are just clues, not the final diagnosis. Any one of these noises could be caused by something as simple as mucus from a cold, or something much more complex. They point toward a whole range of possibilities, from infections like pneumonia to chronic conditions like asthma, or even issues with the heart. But, and this is so important to remember, a doctor can't diagnose you based only on a lung sound. Auscultation is an incredibly powerful tool, for sure, but it's just one piece of a much, much larger puzzle. It all fits into a logical process. Your doctor starts by talking to you, getting your history and symptoms. Then they'll do a physical exam. And then they use what they hear through the stethoscope to help shape their ideas and figure out, okay, what's the next step? And that next step often involves getting a better look at what's going on. Based on those sounds, a doctor might order a chest x-ray to see the lung structures, or blood tests to check for infection, or even special breathing tests to measure exactly how well your lungs are working. So this all leads to the most important question, doesn't it? When should you be concerned about your own breathing sounds? Let's quickly run through the most important warning signs to look out for. Okay, pay close attention here. These are the red flags.
If you see bluish skin or lips, if someone's nostrils are flaring just to get enough air, or if you're having any kind of severe trouble breathing, that's a medical emergency. You need to get help right away.
Now, for any other new or worrying breathing sounds, like a wheeze that you've never had before, the key is to just be proactive. Please don't try to Google it and diagnose yourself. Your doctor has the training to figure out what's really happening. Just make that appointment and get it checked out. So, the next time you feel that cold stethoscope on your chest, you'll know. It's not just some cold piece of metal. It's a tool that's listening to the story your lungs are telling, one breath at a time. And the only question left is, what story is yours saying?